There's nothing like the experience of being on the bed to inform a caregiver who stands beside it. True empathy of the experience for the patient and for the family. Being on my side of the bed is a welcome change from the last year. The night of the 28th of February, we got the confirmation of the first coronavirus case at Evergreen, realizing that a patient that died earlier in the day was COVID. We got the test back. This thing is gonna change everything, and we stood in just stunned silence. Tuesday the 3rd, that was probably the day I got infected. In retrospect, started having COVID symptoms on Saturday. I had a mild headache, didn't think too much of it. And then it wasn't until Monday, the 9th, that I had more of a traditional syndrome of, flu-like symptoms. And then the suspicion started to creep in. Pretty soon thereafter, started having shortness of breath and chest pain, and found that my oxygen levels were dangerously low. Finally we had a couple of measurements in the 80% range, and my wife, then fiance Connie, looked at me and said, "I'm gonna go pack a bag and we're gonna go to the hospital," and I knew it was time. On the morning of Friday the 13th, my physician at the time, Dave Baker, and I talked about the fact that no one had come off a ventilator at that point. Either you died or you're still on and would probably die. It was time to put my life into someone else's hands. They tried absolutely everything. Azithromycin, hydroxychloroquine, remdesivir, vitamin C. ECMO is a technology that essentially takes blood out of my body and oxygenates it by a machine and delivers it back. I woke up 16 days later in another hospital, in another world. After I woke up every day, they'd reveal a little bit more of what had happened to me, and it was mind-boggling. It was like it happened to someone else. On my 45th birthday, I was in the hospital. I'd been awake for about 5 days, and I really wanted that to be the day to get out of bed. You don't realize how hard it is to simply physically stand. You can forget how to do it. You're so weak that someone has to tell you, put your nose over your toes. There are a lot of conversations with yourself to say, we need to be okay with this if this is as good as it gets. I'm alive and I'm back to work. So I was excited to come back and hopefully give some relief to my partners that have been in the fight since late February. The constant death, the exhaustion emotionally has been really traumatic. So I hope to give my partners a rest and, to give them some hope too. My ability to wake up was just this incredible effort of hundreds of people. Docs, nurses, techs. I'm not sure you can get any more lucky than I was. I would have been one of the first 1,000 deaths, and now we're somewhere over 500,000 people. And those are all individuals. Those are people with families. Those are your neighbors. My hope is that we can be patient as we work our way out of this. It's the right thing to still be vigilant with masking and distancing. I mean, we've lost 200,000 people in the last 2 months, even in the midst of vaccines being released. So there's still a lot of risk. There's still people that are dying of this. I'm fortunate, and I'm the exception.